Hi everyone, welcome to episode 15 of Let's Talk Mental Health. On today's episode, we're going to be talking about autism spectrum disorder, and we have a very important guest with us today. She is a prospective clinical social worker. She loves God so much, a firm believer of the gospel, and she has this passion for seeing people live and thrive and operating their fullest potential. Let us welcome Miss Olifin Arma.
Hello everybody, I am Olifin Ama, a prospective clinical social worker, and I'm going to take you all through a brief information on autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental disorder with early childhood onset. It's a spectrum because signs and challenges vary among individuals. Autism spectrum disorder is a condition that affects a person's ability to communicate, to interact socially, and to engage in flexible, age-appropriate behaviors. According to the DSM-5 criteria, there are 12 symptoms of autism spectrum disorder. These 12 symptoms can be categorized into 3 features. 1. Social interaction impairment. Children or individuals with ASD have difficulty forming and maintaining relationships, difficulty giving eye contact or following social rules. 2. Communication deficit. Persons with ASD, their speech are either limited or absent. 3. Restrictive repetitive behavior. Children or persons with ASD engage in actions that are consistent and daily. Some of these actions are the flapping of the hand, the back and forth movement, the shaking of the head, and the walking on the toe. Since these signs and symptoms are observed in early childhood, you usually find a child engaging in the action. Now, when a child is engaging in consistent daily action, is a sign of ASD. According to the DSM-5 criteria, these 12 symptoms that are categorized into these 3 features must be present in a child before they can be diagnosed with ASD, autism spectrum disorder. There are several risk factors of autism spectrum disorder. These factors include 1. Genetic influences. Research has it that 90% of persons with ASD inherited it from a descendant. 2. Prenatal exposure. When a baby is still in the womb and that child is exposed to certain drugs or infection from the mother, that child is at risk of coming down with autism spectrum disorder. 3. Parental age. A certain age poses a risk on a child coming down with autism spectrum disorder. For example, older persons conceiving, there are contributing factors to children or babies coming down with autism spectrum disorder. 4. Premature birth or low birth weight is a contributing factor of autism spectrum disorder. Lastly, neurodevelopmental factor such as the Fragile X syndrome is a major risk factor of autism spectrum disorder. There is no cure for autism spectrum disorder, but early structured interventions greatly help improve condition in persons with ASD. Some of these interventions are behavioral therapy. Behavioral therapy can be used to address the restrictive, repetitive behaviors within individuals with autism spectrum disorder. Another approach would be special education. Giving special education to persons with ASD will greatly help improve their quality of life. Another approach to providing great impact would be occupational therapy. Occupational therapy would be to teach the individual how to go about their daily life, how to live his or her life. Another approach would be social skills. The social skills will be the persons with ASD will be taught to know how to relate with their society. And lastly, one of the approaches that will really help with ASD will be parent training and counseling. You usually find out that parents whose children have ASD find it difficult to cope or provide support for their children. So the parent training and counseling gives a clearer picture of what the disorder is and how the parent can help their children live quality life. Thank you for giving me your ears. I hope this information serves you well.
We want to say many thanks to Ms. Olafin Amar for teaching us today about autism spectrum disorder. I hope you learned something, because I did. And that is about it for today's video. Remember, an informed mind leads to a changed behavior. I am Merva M. Smold, a clinical social worker. And until our next video, adios.